The way we take care of ourselves is ever evolving. And what we know for sure is that our mind and spirit are linked to our physical body, and that our wellness seems to extend into our communities and the planet we all share.
It is very, very clear that wellness is interconnected.
We love spending time with you to explore and practice the breakthroughs, the insights, and the passions of incredible people helping us all see the world in a whole new light.
This is Health Gig. Our guest today on Health Gig is Dr. Nelli Gluzman. She is delightful, she is brilliant, and she has information that I can't wait for everybody to hear. If you've got little people in your life, little children, all the way up to teenagers in your life, you won't want to miss this conversation. Welcome, Dr. Gluzman, to Health Gig.
Oh, it's such a pleasure to be on Health Gig. Thank you so much, Tricia, for having me.
We are thrilled to talk to you because both Doro and I are grandmothers, and we love our little grandchildren, and we talked to our sons, my sons and her daughter, and said, what would be your burning questions to ask Dr. Gluzman? So we've incorporated those into our discussion today, if that's okay.
I love that. That's perfect.
So why don't you fill us all in? Who are you? What do you do? And why do you think it's so important?
My name is Dr. Nelli Gluzman. I am a pediatrician. I'm a board-certified pediatrician. And my background is hospital medicine. So for 13 years, my role was to make sure that if your child gets hospitalized, I can get them better and back home to you. So it was like emergency medicine and making sure that we treat things like pneumonia or dehydration or anything that might land a child in the hospital. A very conventional way to treat illness. When my daughter was about 4 years old, she's older now, but when she was about 4 years old, she started getting sick over and over and over again. And moms and dads who are listening, there's getting sick and then there's really getting sick. And that 1 year, she was on like 7 courses of antibiotics. Every time she would get any small viral illness, regular colds that kids get, it would turn into a bacterial infection and she needed to be on antibiotics and missing school and getting all these rashes and having trouble breathing and constantly sick and unwell and just not thriving because she was always sick. And I was already a pediatrician. And I thought that I knew everything that there is to know at this point about what it means to heal and treat a child who is sick. But when I realized that there is more to the story, how do you prevent all of these illnesses? How do you make sure that a child has enough resiliency to fight off all these colds and not have this overwhelm of inflammation all the time? I realized that there's so much more to medicine and to healing and to health, and it's just a different part of medicine. And that's what took me on a journey for my own daughter, find a solution, and it worked really, really well. I found it's very rare where I am in New York and New Jersey to find a pediatrician who is a pediatrician, but also practices what is integrative, functional, and a quote unquote holistic way of looking at health. But I found that doctor for her and he gave me a regimen to put her on. And I did it for a couple of months and it was some dietary changes, it was some supplements, and it completely transformed her life. And when I saw the change that happened in her, she was thriving. She was able to, if she did get a cold, she didn't need to be out of school forever and days and weeks, needing to be on antibiotics anymore. I mean, it was a complete transformation. And that's when I knew I needed to relearn what it means to give a child the building blocks that they need to heal and grow and thrive so that they have all the resiliency. And that's what I did. And I opened up my practice, which is Blossom Pediatrics, and it's in New York and New Jersey. And it's an integrative, functional, and holistic practice intended to keep healthy kids healthy and to treat kids who are really sick all the time, who are having chronic, constant problems and lots of medications, to get them off these medications so that they're not having all these symptoms anymore, so that they're resilient kids, have all the building blocks that they need to continue to be well.
Well, that's incredible that you found this path, Dr. Gluzman, and I think all of us are going to be better for it when we have pediatricians actually looking at the whole body of our children. But when you talk about building immune resilience, I mean, I think we all know what that looks like. Children go to daycare, they come back and they're sick. And I know in a lot of cases, they're sick all year round with runny noses, all kinds of stuff. Can you talk about that and what moms and dads can do like first line of defense? And then what do we do when they get that? And then how do we deal with the chronic issues?
I think when we think about immunity in children or all people, we think about making sure that if there is some kind of illness, we're able to fight it off. And it's really expected and normal for kids to get colds, especially when they go to school. And I would even say it's very healthy for the immune system to mature this way by being exposed to different illnesses, especially with like younger kids. This is how we build a healthy immune response.
When you say younger kids, like babies, like under a year old, or what do you think?
Any ages, of course, we want to keep our youngest under like 1 year old from getting a lot of illnesses that can cause fevers, but mostly like school age. That's really, in my opinion, normal for a child to be exposed to and be able to fight off illnesses. Immune resilience also means that when their child is exposed to things in our environment, normal things in our environment, like different foods, different kinds of grasses and pollens and trees, that they're not creating an immune response that's unhealthy, like allergies or eczema or asthma or wheezing, which is what we're seeing so much of. So when I think about immune resiliency, I think, yes, of course, we want to make sure that our kids are able to fight things off properly and not need to be hospitalized or needing a lot of medications to open up their airway or steroids to calm the inflammation or antibiotics too much. Of course, if there's an emergency and we need to use antibiotics, we do. But for most cases, we want to see our kids fight things off. But we also want to make sure that that response is not one that is inappropriate, that is constantly there, like all of the allergies that we're seeing, all of the food allergies, the anaphylactic allergies, the seasonal allergies. I'd like to challenge everyone listening right now. When you were in school, how many kids did you know in your school, in your classroom, in your playground, in your playgroup, all your neighbors, all the kids that you were surrounded by when you were a school-age child? How many kids did you know that had severe anaphylactic food allergies where they could end up in the hospital if they were exposed to a food that they were allergic to, like peanuts, for example? Because right now, it's about 5 to 10% of kids in the US. The numbers are staggering. And that is also part of a healthy immune response, making sure that the immune system is not fighting something that's not there, like an autoimmune response, and not constantly being confused as to what is a normal thing to fight and what is an actual attack from a virus, bacteria, or fungus.
Yeah, I think that's a really good question. I know way back when I was growing up, we didn't even hear of anybody having peanut allergies. And then with my children, it was just occasionally, like an occasional one. And then as they got a little bit older, you're hearing more and more about it. So what is that and why is that happening and how do we avoid that? And I know we want to talk about the gut microbiome, but can you kind of tell us why this is all happening now?
It's multifactorial, and the short answer is there are just so many different factors outside of our environment, like not inside our bodies, but outside in the environment, that is causing a lot of inflammation. These are inflammatory problems. So you have environmental toxins, you might have a combination of that plus foods that have a lot of pesticides on them, like Roundup or glyphosates. You have maybe foods that our kids are eating that are not as nutrient dense as they might be. Then there's a lot of preservatives put into the foods. There's a lot of changes in our air quality. It's coming from a lot of different directions. There are the things that we put on the skin. There are the things that we eat. There are increased stressors, emotional stressors, and I'm talking about just like pediatric population. So it's multifactorial, but don't worry because there is a solution that has been very effective, and that is addressing the problem at the root cause. The place where we need to focus on the most that works really well is optimizing, like you said, Tricia, gut health, because a healthy gut lining that has a good, healthy, diverse microbiome, which is all the organisms that live inside of us that help protect us and not necessarily harm us, creates a healthy gut lining that doesn't allow for things to get into our bloodstream as easily. An unhealthy gut lining will allow a lot of the large molecules like foods or viruses straight into our bloodstream because the gut lining is only one cell layer thick. And when it doesn't have a healthy microbiome that's diverse, that has the right kinds of healthy microbes, plus there might be some tight junctions, kind of like a wall. When that wall starts to break apart, things get into our bloodstream very easily. And that's where we see a lot of allergies, eczema, and younger age, things like wheezing or asthma or autoimmune illness happening. And so the way to really approach it from the root cause is to optimize gut health. And it's actually a lot easier to do than you think.
And you're saying if we can focus our parents on this idea of taking care of the gut and understanding the connection of the gut to so much, we might then see the reduction of illnesses or severe illnesses. Because as you're saying, it's okay, they pick up a cold, but they fight the cold and you get through it quicker. That's the idea here, correct?
Correct, yes. And not only are you able to fight it off, but your body is less likely to start attacking itself or be constantly inflamed by the barrage of different molecules that are getting into the bloodstream, even when it's not a cold. It's kind of like the step you can't skip. One thing to treat symptoms, and that's really, really important. So if there's itching, we have medicines for that. We have steroid creams that could stop the itch, that could make sure that your child is sleeping through the night if they're having dermatitis or eczema. If there's a breathing problem, we have medicines to make sure that their airway is nice and open and not so inflamed, inhalers, medications that reduce allergy symptoms really well, like all of the medicines that we buy in the pharmacy, right, to treat symptoms.
So tell us about the gut-brain connection and why the gut's called the second brain. Maybe we could just start from the beginning. Why is it referred as the second brain? And then how does that affect the children's behavior too?
We spoke about how the gut influences our kids' abilities to fight off infections, right? We spoke about how a healthy gut lining and a healthy microbiome in the gut health, influences our kids' ability to not have all of these atopic illnesses like allergies, eczema, asthma. We spoke about how it's related to autoimmune illness. I would actually say that the gut is the first brain.
Oh, not the second brain. Okay.
You're able to study it now. And so many brilliant people who study the gut-brain connection will call the gut the first brain because this is where you're seeing most of the neurotransmitters being produced. Neurotransmitters for the brain are produced in a healthy gut. And so if the production is not there, the neurotransmitters like serotonin and dopamine and all of the things that go into our brain to connect all of the brain cells, that's made in the gut.
Wow. So the neurotransmitters, are they a constant thing that are made? Are you born with them? How's that all work?
You're born with them and they're constantly being made. And the kinds that are being made are always adjusted for the needs of a person. So it's always changing. And that's a good thing. That's a good thing. That means that whatever situation you're in right now, there's very simple steps that can be taken to optimize gut health, to give your body or your child the building blocks that they need to heal. And that why we're seeing such a massive problem right now is because this is where we're seeing the biggest damage is gut health. And that's relating to really all chronic problems, including if a child doesn't have the right neurotransmitters. A lot of microbes actually create something called postbiotics, which are essentially neurotransmitters that are made by the healthy bacteria that live in our gut. It's not just our bodies making the things that protect us, it's the healthy bacteria making the things that protect us as people.
That's so fascinating to hear you describe it as maybe the first brain, the brain. And this obviously, and I know you want to talk about this, the skin brain connection, the immune system that we just talked about, like it affects everything.
Absolutely everything.
Wow. I know when I talk to young moms and dads that, their kids aren't eating healthy. How do I even get them to eat? All they want to eat is bread or rolls or that kind of thing. And they're little. And how do we get them to have a healthy microbiome? And the second question is, do you recommend testing their microbiomes or would that not really give us much information?
I love these two questions.
Okay.
So what I spoke about, it sounds very doom and gloom. And I would like to say that it absolutely is not. In my practice, I am just floored by the amount of improvement in kids who are constantly chronically sick all the time, just unwell, just by making a few small changes. And it doesn't have to be overwhelming at all. It doesn't have to be perfect by any means. I know that like moms and dads who are listening, who are busy, who have work to do, and the kids are picky and they don't want to eat a lot of different things. Small changes make big impacts. I'll give you a few examples that might resonate with some of you listening right now. For example, what if you just focus on switching out one meal for the next week or so? Just one meal. Not everything has to be perfect, but start with just one meal. The biggest improvements that I've seen for families that I work with are if you're just going to maybe don't throw everything away, okay? We don't want to be wasteful, but the next time you go to a store, don't put in your cart the things that have a lot of added sugar to it or any added sugars to it. Instead, just go for fruit, for example, right? Or even one meal, like let's say breakfast, right? Just switch to a smoothie and throw everything in there that your child needs for the day. All of the fiber, the greens, the veggies, the fruits, all of the proteins that you could add in, and healthy fats like seeds. You could put a lot of really great things into a smoothie. Most kids like smoothies, and if they don't, put them in like an ice pop mold, like a silicone high quality ice pop mold that looks like, for the younger kids, like a little monster. And then you have that set up for the whole week. It takes 5 minutes to make. And that ice pop is a smoothie that has a lot of healthy foods that we're switching out. So instead of like a snack that has a ton of sugar and is ultra processed, the packaged stuff that has a lot of chemicals and coloring, switch to that one ice pop. Kids will get used to it. And it's not about removing things. It's about adding things in. So if you're the kind of parent that's like, I can't right now remove anything, how about just adding one healthy snack per day? One healthy snack. So there's a lot of different ways to do that. I know as a parent, I get overwhelmed. I get overwhelmed when I know that there's this perfect way to do things, but it doesn't match up to my ability to do everything perfectly because I'm a human being and I'm a mom and I work and there's just so many different factors. And my kid is not always with me. And then there's the birthday parties and the, dare I say it, like the grandparents, and getting everyone on board and the whole family on board, all of the after school activities, the snacks that are given in school. These are all real things. Don't stress out. If it means that you're just adding 1 or 2 healthy foods into your family's routine per week, start there because it will make a massive difference. I would say that there's 2 different foods that I find to be the most helpful in the process of healing. And I'll tell you what those are. One is stocks and bone broths. High quality stocks and bone broths. They're made from really high quality bones and meats, and they're fresh, like they're maybe frozen. They're not the powders. They're not the shelf stable powders. They're the ones that are really, really high quality. There's a few brands that I like, that I work with personally, that I think are great. I'm not like sponsored by them. I just recommend them to my patients often. I really like one brand where I am located in New York and New Jersey, but they became national now. It's called Brodo, and they make really good bone broths. Try to find the frozen ones. There's another brand that's it's pretty available in like a lot of different stores. It's called Bonafide, the frozen ones. And there's this one company in California. It's a small company. It's called Owl, like the animal, Owl Venice. So like those are great to have at home. If you're not going to make them yourself, find one that's really high quality like those. So stocks and bone broths, that's all the collagens, the amino acids, they're anti-inflammatory. Those are the building blocks that a healthy gut lining needs to grow and thrive. Those are literally the building blocks of a healthy gut lining. And the second is fermented foods. Okay, lacto-fermented foods. And I know you had amazing, brilliant people speaking about the power of ferments. And I could honestly say that if I could just have one medicine in this entire world to treat my patients with, it would be fermented foods. Fruits and vegetables that have been fermented to create a probiotic absolute powerhouse. You know it's alive because it's not spoiled. It has the greatest diversity of natural, healthy microbes. They're usually delicious. You could find kid-friendly options. So when we think of ferments, we think of like sauerkraut, for example. Not all kids like sauerkraut, I know. You have to get used to it. But then there's brands like this small brand that I love. It's called Fermenting Fairy. You can get them online, and they make kid-friendly ferments like fermented applesauce, fermented lemonade. I would say that it's just so powerful, so healing. Those are the healthy microbes that create a healthy gut lining, that makes sure that our kids are able to digest all the foods and absorb them properly. Those are the microbes that help convert our vitamins into absorbable forms. Those are the microbes that create our neurotransmitters for a healthy gut-brain connection. Having those every single day does not have to be a big amount. For an adult, I would say a quarter cup a day of a high quality ferment is amazing. There's companies like Small Town Cultures and Hawthorne Valley Farm. These are kind of local to the Northeast where we are. Those companies make things like fermented carrot sticks, which are a great finger food. Like if you're going to the playground, instead of just regular carrot sticks, create a probiotic powerhouse. These are the two things you could start with. Like if you're going to add anything, bone broths and fermented foods.
So the little ones, we just have to start incorporating them, getting them kind of used to this. And I love that idea of the carrot sticks. So you said just get the fermented carrot sticks.
It's usually seasonal. That's why I like these smaller brands, because whatever they're growing, they're going to ferment. So it's picked when it's most ripe, and then it's a very simple process. You're just adding salt most of the time. And you can make it yourself at home as well. So these are pretty simple to do. It's just salt and the vegetable or the fruit, and then you just let it sit on the counter. I mean, of course, read your instructions because everything it is alive. So caveat, like smell the thing before you eat it.
And this is what you're saying is the first step, that if we could just start getting the root cause again, getting the microbiome or the gut healing. So the leaky gut begins to heal up. It's not going to send out the stuff into our systems anymore. So it's tight, so to speak, right? And secure. So now all of a sudden your immune system improves because it's not fighting off all these other things. Is that why?
It's not trying to fight all of the things getting into the bloodstream. Those junctions that get leaky close up. And because our kids are getting so much more nutrients when they have the right microbes to protect that gut lining, they're able to digest food better, and all of the healthy food that you're giving them, they're able to absorb it better.
And skin disorders, when children or adults or anyone has skin disorders, is that an indication of leaky gut?
I'm in both worlds. I am in the realm of allopathic, traditional, conventional medicine. So as a pediatric hospitalist, I know that in that realm, if there's a child with eczema, it's treated with symptom management like steroids, steroid creams, or non-steroidal creams that suppress the inflammatory response on the skin. The other world is, what can you actually do about it besides and in addition to treating the symptoms? In my practice, I would say most of my patients are coming because younger and younger, there is really severe eczema. Just treating the symptoms is not working. It's just not enough. And some of these kids have been on these steroid creams with higher and higher and higher strengths for weeks, months, years. And some of these kids are really young. And so just treating the symptoms or avoiding some of the triggers like allergies is not enough. And so in the realm of an integrative practice like mine, or in functional medicine, we try to give the child the building blocks that they need to calm all that inflammation first. And that means, again, optimizing gut health. That connection it's not a skin problem, what we're seeing when we're seeing things like eczema. What we're seeing is inflammation from the inside out. And it's coming out in the skin. And of course, it's important to moisturize and to avoid chemicals that could worsen things like rashes and eczema. But at the same time, we want to decrease all the inflammation from the inside out. And those inflammatory processes are coming from an unhealthy gut lining and an unhealthy microbiome. Those are usually the steps that we start to take, in addition to, you asked me earlier about testing. And testing is helpful because everyone's needs are different. So you have many, many different children who have eczema, but the exact microbiome reasons might differ. Just because the symptom is the same and the name of the diagnosis is the same, let's say it's eczema or allergies or asthma, or even like digestive issues, it might be coming from nuanced, different microbial imbalances. And so I love to test because I can do that and I can read the results, but there is a test that is helpful for a lot of families that might not be able to get to a pediatrician like me that can help create a protocol that their child needs. I'm not sponsored by this company, but I think that they're doing a phenomenal work, and it's called Tiny Health. I'm just a huge fan because it's really easy to use and the results are very helpful for a lot of families. It's a very simple stool test and it's easy to do. So all you need to do is like take a little Q-tip that they send you in a kit and swab the stool of your child, like whether that be a diaper or toilet paper, and then you send it back in their box. So it's really easy. Like you don't have to collect a whole sample, and the results come back to the parents.
So the parent can order it and the parent can get it. So it doesn't have to be from a provider. Fascinating. And Tiny Health, is that up to any age or what age groups do you recommend it?
They also do adult tests. Their technology is phenomenal. I've been a huge fan from their beginning. They really do specialize in kids and any age. So birth to 18, and then, of course, adults as well. Because the needs of a child are so different and in every age, because a baby's microbiome is going to look so different when they're a month old, 2 months old, 3 months old, 1 year old, 2 years old. And so all of the results, age is factored into all of the recommendations.
So you recommend parents do this because they can have a roadmap. And if they have a doctor to go to and share it with the doctor, the functional medicine doctor, will it tell us what foods to add in? And does it actually say it?
Yeah, and not just like what's good for your child. That's really important. Like what is good for your child to eat? High quality fruits and vegetables, very clean proteins, right? We know all this. If you're listening to this podcast, you might be familiar. But the results will tell you what your microbes need to be eating to grow out the healthiest microbes because they have their own needs. I love that because you could really take their exact recommendations and implement it and add things in. It's a test that will tell you what you can do as a parent right now to make sure that your child's microbiome is healthy.
Oh,
And
I love that.
cornerstone of health for children.
And what supplements? I guess it'll tell you supplements, but are there general supplements that you'd like to see kids on?
Supplements are helpful when they're very carefully selected. I am very, very picky with the supplements that I recommend. I don't think that every child needs to be on a multivitamin. I think some kids might need to be on one, and we can test for it. I see a lot of deficiencies in things like vitamin D, which is a master hormone, and it's really difficult to heal when vitamin D levels are on the lower end. Very frequently, I think about optimizing that, and that might mean supplementation because it is really difficult to get vitamin D outside. Even if your child is outside all the time, everybody makes vitamin D differently. We live in different places. That's one supplement that I tend to lean on a good amount, but everyone's supplement needs are different. And there's not one that I would say is for everyone. Like not everyone always needs a probiotic. And the kinds of probiotics we're choosing, most of them are dead, unfortunately.
Interesting.
You really need to be very cautious. And supplements, in my practice, I always tell parents that supplements are a bridge. It bridges a gap while you're doing other things as well. There is no magic bullet supplement that's going to heal a child, in my opinion. Like, I have never seen that happen, and I wish there was one, but there isn't. It's a multi-pronged approach. It's adding things into your child's diet that will give them the building blocks they need to heal. Like fermented foods and bone broths are an example of that. Making sure we're taking things out of our child's system that might be causing more damage, like a lot of added refined sugars, chemicals, preservatives, colorings, taking that out as much as we can without stress, without stressing the whole family out, maybe doing that very slowly, maybe just reading labels more and more, using testing to see what exactly needs to be done if that's what's needed, and some key supplements, very targeted and a temporary measure.
I love that too, because I guess the next question is, so we give our children supplements or we take supplements, we don't have a healthy gut, it's not being absorbed anyway.
Correct. Yeah, it's not being absorbed anyway. You cannot skip this step. Treating kids who have chronic problems on multiple medications for a long time, who have a lot of different issues, and they're not just sick kids. I cannot tell you all listening right now how important it is to optimize gut health. You cannot skip that step. You could take a whole bag of supplements, but without optimizing gut health, it's just not going to be as effective.
And then, as an integrative doctor, what do you do to talk to the parents about the mind body connection? How does that play into your practice? And how do you see that with the health of the children and I guess the adults and the parents too?
I could tell you where I see the biggest problems. Yes, of course, it's very nice to teach our kids how to breathe, how to meditate, going outside, spending time in fresh air, spending time in nature, being active. That's all very important. But the biggest roadblock that I see kids have is screen time addiction. It's a real problem. And it is creating an enormous amount of stress on our kids. I don't know if I can really comment on how much screen time is a safe amount. I think that means different things to different kids. Does my kid cry and scream and shout and throw a fit if I take the screen away? You might want to look in that direction. I've only seen massive improvements when screens were taken away. And I'm not talking about like having family movie night where it's interactive,
Right.
watching the same show or movie that is kid friendly, that you're all together doing it. I think that's great. In moderation, of course, but like that's great. I'm talking about when your child is staring into the screen, there's 8 windows open, a chat box on the left, another chat box on the right, there's a little bit of violence on the left, and then your kid is like watching another kid playing something that is violent. If you've seen that before, if this at all resonates with you, consider limiting that, because that is a huge stressor on our kids' bodies, and it's also impairing their ability to sleep optimally. All of the blue light and all of the late night like blue light that is going in through their eyes and into their brains and affecting their ability to create melatonin, which is the master hormone for sleep and circadian rhythm. They might be sleeping well, but they're not getting the rest that they need as well as they should be getting it because of the amount of time on screens. In a world where in school we're seeing more and more and more utilization of technology for education, if we can limit those things at home, it's going to only help.
And I guess then encouraging the kids to go outside, encouraging the children to maybe read a book or read with them or that kind of thing.
I'd say anything else is better. Any kind of after school activity that doesn't involve a screen, any sport, especially sports. Anything that moves their body, even walking the dog will be phenomenal.
Yes, I see. So get moving, basically. I guess that kind of lands into the importance of exercise for children and getting them to move, which actually helps them overall with everything, right?
Absolutely.
Boosting their immune system, all of that with exercise, right?
Only benefits.
Yeah.
We've all heard,
Yes.
go outside and play.
Right. So true. So can you talk about the importance of rest for children and sleeping? How do we encourage that? How does that work?
Rest for children. Well, that could mean 2 different things. One form of rest could mean sleeping. Making sure that our kid is getting the right amount of sleep for their age is important. But something else that I want to point out is we're seeing more and more kids who are snoring or mouth breathing, really not just when they're sick, but all the time. That means that they're not sleeping the right way, and that could interfere with neurological development in a big, big way. And so if there's a child who's always snoring, always sleeping with their mouth open, that needs to be addressed with a provider that knows airway and breathing, and that has to be remedied. It takes time. It often goes under detected. Like we know our kids are sleeping, but they actually might be suffocating in their sleep and waking up all the time. And they might not look like they're waking up, but their brain is waking up because they need to breathe properly. Basically sleep apnea in children, and it's a big problem, and that could be addressed in different ways. It could be a problem with an ear, nose, and throat issue. It could be a dental issue. So going to your regular pediatrician and then pointing out, saying, my kid is always snoring and is always breathing with their mouth open, even when they're not sick. That is one of the best things you can do to make sure that your child is sleeping properly. Making sure that they're not on a screen right before bed. I would even say like at least 1 to 2 hours before bed, no screens, so that the circadian rhythm can be adjusted properly, so that their brains can get the proper type of healthy sleep. Our kids are busy, we're busy, there's so much coming in every direction. A lot is expected. We have a lot of kids who do a lot of different things, right? Like activities and all sorts of just life. Maybe taking some time to do quiet activities is also, in my opinion, considered good rest.
What's your thoughts on melatonin in general, melatonin supplements?
I think it's very dangerous.
Can you talk about that?
I'm not a fan. I can only speak for pediatrics. Melatonin is going to work, but it's a hormone. And melatonin doesn't just control sleep, but it's a hormone that controls other processes in the brain. And when you give somebody melatonin for an extended period of time, and that time period, how many nights in a row or how often is up to debate in science right now. There's no exact literature. I have my opinions. But using that all the time to optimize sleep or have a child fall asleep, they'll stop making their own melatonin. And so you kind of get hooked on it, on this hormone. We don't really know what we're getting in most of these melatonin supplements, to be honest. Even when they're saying this is a great melatonin supplement, the dosages are very variable. We don't know what we're getting. And so I see kids fall into these cycles where they cannot fall asleep without their melatonin anymore. I think that using these kinds of medicines very, very rarely, like if there's jet lag, I mean, never is better, but very occasionally, and never more than like 2 nights in a row is okay, but never, ever more than 2 nights in a row. There are a lot of kids, like teenagers, who are using melatonin gummies because they're targeted for kids and teens because they're delicious gummies, right? They're using them every day. And so their sleep is really disturbed. So instead of you're thinking, does my child need melatonin all the time? You have to address the root of the problem, because just treating symptoms is never going to be a long-term solution.
So, talk to me a little bit about the gut health and behavioral issues. And I've been talking to a lot of parents lately who have just said that their kids are acting out more than they've ever acted out, more frustration, sounds like anxiety. Many of the doctors would like to put them on a medication. So, what are your thoughts about all of that?
This is always going to be between you and your child doctor. Everyone is different and everyone's needs are different. But I think that, no, I know that if a child needs to be placed on medications and that's decided, because these medications treat symptoms, I would always, at the same time, consider making sure that your child is not constipated, that they're getting all their nutrients, because nutrient deficiency can cause these symptoms, that they're not anemic, they're not getting enough iron, and they're not able to absorb enough iron. The same symptoms of iron deficiency in children will show up as some of the symptoms for ADD, ADHD, anxiety.
Whoa.
So looking at it holistically, the whole body approach at the same time is really important. And there's no harm or risk in making sure that our kid is not constipated, is stooling properly, is getting the right kind of fiber, has a healthy microbiome. Because, like I said before, a lot of these neurotransmitters that might be insufficient or imbalanced are created in a healthy gut. So I urge all of you listening, if you're needing to take any of these behavioral medications, and they might be necessary, it doesn't mean that they need to be on them forever, and that there are many things you can do to make sure your child is feeling better. I cannot tell you how many of my patients, young patients, were able to come off all of these medications that were intended to optimize their functioning in school, like all of the ADHD medications, anxiety medications, etc., on and on, right? I cannot tell you how many kids were able to come off these medications because they were no longer constipated.
Wow. And what you're saying with the constipation, that's an indication that their digestive system isn't correct. They need some assistance, so they're not getting the nutrients. And as you said, which I've not heard, is that iron deficiency looks like symptoms of ADHD and ADD. Wow.
Yes, and that can be very simply determined. And treating constipation doesn't mean just making sure that you give them medication so they could poop every day. Like, that's occasional use only. It's making sure that they have all the building blocks that they need to be able to poop by themselves optimally in a healthy way every day. This is the number one way that kids get rid of their toxins. And if they're not getting rid of their toxins, they're feeling really bad. And this is where we're seeing some of these increased symptoms that could be interpreted often as psychiatric issues.
So what do you do for constipation? Go back to the building blocks, right? But tell us what you do.
When the child is constipated, something needs to be done, right? Usually something like polyethylene glycol, that's like Miralax, is like the go-to in the US, or Dulcolax, a laxative. But then there's another way to promote a bowel movement, and that's using a magnesium supplement, the right kind of magnesium. There's this one supplement that it's so much less toxic than a lot of the laxatives that are usually in pharmacies. It's called Mag Go Kids. Mag, like magnesium. It's a more natural way to promote stooling. Of course, always speak to your pediatrician. This is not medical advice.
Right.
Everyone's needs are absolutely different, but something to consider, like a cleaner alternative to treating symptoms of constipation short term. But if you're needing to rely on these medications all the time, then optimize gut health. That means stocks and bone broths, fermented foods, maybe doing some testing, like Tiny Health is one example, and making sure our kids get enough fiber, because about 2 kids, it's kids, in the US are getting enough fiber, 2 out of 10. Take an inventory of how much fiber, fruits, veggies, is your child eating in the first place.
How do you feel about fiber powders, protein powders in general, and then for children?
I have never met a protein powder that I liked.
Really? Even for adults too?
I've never met, I haven't found one. I'd like to, because it would be easier for me as a person who would love some more protein in their diet without needing to eat a whole meal. But there's an alternative. Like, if the way that we're using protein powders, which means that we're mixing it in something, instead we can add things like hemp seeds, chia seeds that have nearly almost as much protein, but it's not refined, and there's healthy omegas there. They're so much healthier and almost the same amount of protein, especially the hemp hearts, like hemp seeds or hemp hearts.
Mm-hmm.
There's a lot of people using alternative milks as well, right? Like, we love our almond milks and our oat milks and all of them. All of the milks that are non-dairy, most of them have a ton of anti-caking agents, chemicals, preservatives, and sugars. Please read your labels. Because if it's not a food, then it shouldn't be in your child's system. But there's an alternative that I just cannot believe people don't know about, and it costs almost nothing. It's good for your kids' brains. It takes less than a minute to make, and it's a milky, delicious milk alternative, and it's making your own hemp milk. And all you need is a blender, water, hemp seeds, and something like a date to sweeten it, and that's it, and blend it. You don't need to soak, you don't need to strain, you don't need to do any of that. And the hemp seeds are really great for brain development for kids as well.
And do you like that better than making almond milk for kids from scratch? Because almond's a seed, right? I'm trying to think of what is it about like fresh almonds? Same thing?
They're both great, but one takes a minute and the other takes like 2 days.
I gotcha. So the hemp milk is just put it in the water,
Yeah.
add a little date. Oh, great. Wow.
It's a fraction of the cost. Anyone can do it. It's really easy and it's extremely nutritious.
What is your position on dairy?
I made a podcast, one episode. It was a couple of years ago. My podcast it was about dairy, the most misunderstood nutrient. Position on dairy is that dairy can be healing when it's high quality. Dairy can be a high quality food when it's made from healthy cows or healthy goats. When the animal that is producing it is one that was outside and has natural vitamin D, like vitamin D doesn't have to be added to it. The animal didn't get steroids, didn't get antibiotics. Quality matters. Quality matters in a big way, especially when this dairy is fermented to create a kefir or yogurt, then it becomes a probiotic powerhouse. I am not a fan of using dairy constantly in a diet that hasn't been coming from a healthy source. Might not be very beneficial to a lot of kids who don't have a lot of resiliency in the first place.
So look for other alternatives for the kids too. But if they are loving milk, get them high quality.
It is worth every penny.
Yogurt and kefir made from grass-fed. Is that it? The A2, or what labels would we look for?
You want to look for A2, grass-fed, or organic is good too. Definitely organic. Grass-fed is even better. And then goat milk or A2 is a kind of dairy milk. So A2 is excellent as well.
Wow. What else haven't we covered that you think we should cover? Because this has been fascinating.
I spoke a lot about very scary things, but I think that if you just get on the path of making small changes, these small changes add up and they can make a big difference in your child's life. You don't have to be perfect from the beginning. And any kind of chronic condition that a child is not born with, but has been diagnosed later on, could be much improved by looking at it holistically and using an integrative approach. So not just looking at a skin problem as a skin problem, but looking at the whole body. And just kids are so resilient and they have an ability to heal, and they're able to heal really quickly. Implementing some of the things that we spoke about, or finding a pediatrician that specializes in an integrative, holistic, functional approach is really helpful. There's a book that recently came out that I'm a huge fan of. It was written by a practitioner similar to me, but much more brilliant. Her name is Dr. Elisa Song, and her book just came out and it's phenomenal. And for parents looking for exact solutions on what to do, I mean, this book is exactly how I think. So it was just wonderful, and it's so beautifully written. And it's called Healthy Kids, Happy Kids. If you're like looking to get into this kind of thinking process further, grab this book or get the audio version. She reads it. I love it. So I highly recommend it to my patients as well.
Well, thank you. And thank you for all of this insight. I know that our listeners are going to have even more questions. So we'd love to have you back on.
Thank you so much, Tricia, for having me.
Thank you for joining us on Health Gig. We loved having you with us. We hope you'll tune in again next week. In the meantime, be sure to like and subscribe to this podcast and follow us on healthgigpod.com. I'm Tricia.
And I'm Doro.
Be well.